Hello, everyone, and welcome to EllieMD's live educational series. I'm EllieMD's social media manager and tonight's host, Brenda Rios. We're so glad you're here as we continue our mission to help people live healthier, longer lives. At EllieMD, we go beyond telehealth. We're building a community rooted in education, innovation, and personalized support to empower your wellness journey. Tonight, we're very excited to welcome back Sally Sykes, founder of Empowered Health Consultants. With over 15 years of experience in functional medicine, Sally has helped countless patients take control of their health through root cause strategies focused on insulin resistance, hormone balance, and sustainable weight loss. Her path to this work is deeply personal. After reversing her own type 2 diabetes and navigating the loss of her father to Alzheimer's, Sally made a bold career shift from law to health coaching, dedicating her life to prevention, healing, and helping others thrive, especially women navigating through perimenopause and menopause. Sally, welcome back. It's always a
Hi,
pleasure to have
thank
you here.
you
Yay.
so much for having me back. I just love this group.
Oh, we love you too. Can you please tell us a little bit more about what inspired your transition from law to functional health and what was your journey like in reversing your own type 2 diabetes? That's incredible.
It was a shock, you guys. I've never technically been overweight. I was probably 30 or 40 pounds heavier than I am now, but you don't get flagged for diabetes when you're skinny fat or TOFI, thin on the outside, fat on the inside. I mean, I had fatty liver and a fasting blood sugar of 250, which is well over the limit for diabetes. And the reason that became so relevant to me was because my father had just passed away from Alzheimer's disease at the age of 67. It runs in our family. My aunt has it now. My uncle, I think, is getting it. And it's it's really a terrible, terrible disease. And the more research I did into it, specifically, this is my favorite book. I always point to it. If you have Alzheimer's in your family and you haven't seen me point to it, go get this book. It's called The End of Alzheimer's by Dr. Dale Bredesen. So good. Gives lays out the functional medicine program for prevention of Alzheimer's. There's no real cure, but one of the main ways that we can prevent it is by making sure that we have healthy insulin sensitivity and we do not get diabetes, prediabetes. Yeah, the book is The End of Alzheimer's by Dr. Dale Bredesen. Did you get that, Nicole? So, um, when I realized that if you get type 2 diabetes, it doubles your risk of getting dementia, I got real scared. I mean, my father was already in the grave, and here I was with type 2 diabetes. I already was having brain fog. I was just having afternoon crashes. I had terrible fatigue. I was on the pill. I had hypothyroidism. I had nutrient deficiencies. I was anemic. I was a hot mess of health, and I was only like 41 at the time. So it forced me, my dad was diagnosed even years before that when I was still practicing law. So, and I got married, had kids, stopped practicing law, and then he got sick. And that's what made me say, you know what? I'm going to do a deep dive into the research here. How do I prevent Alzheimer's? He's already got it. What can I do? And so that just because I'm just a research nerd, it just became my own career. So
Mhm.
became essentially a health consultant and health coach, basically self-taught on all of the research of specifically all of the optimal ranges for labs that we need to aim for dementia prevention and cognitive health. And those optimal ranges in functional medicine are very different from the normal ranges that you'll typically see when you get your labs done, right? Because I was told my whole life my labs are normal. They were definitely not optimal. The normal ranges are just the averages of all the usually sick people getting those labs done at that lab. They do not correlate necessarily to good health or disease prevention. And especially as the American population has gotten sicker and sicker and less metabolically healthy, those average or normal ranges have gotten sicker and sicker. And that results in medical gaslighting when you go to the doctor's office and you say, I can't lose weight. I'm losing my hair. I have no libido. My hair is falling out. Like I am depressed and anxious. I can't sleep. Your doctor's like, well, your labs are normal for the average sick American, right? In functional medicine, we look at optimal ranges. So I tried to find all the optimal ranges somewhere on the internet. I figured there would be a list. There was not. So I continue to use my research skills to create my own database of every lab you can think of, all the research showing what the optimal ranges are from books and research articles, everything. Yes. Oh, thanks, Nicole. And that is what that is the foundation of my practice now, is helping patients analyze their labs, learn how to analyze their own labs from an optimal standpoint. So when they walk into the doctor's office, they are educated, they are armed, they know what they should be getting. And then I help them find their own better practitioners who are willing to help. And this is, I analyze labs from everything to thyroid, hormones, metabolic labs, nutrient deficiencies, inflammation and infection. So, been doing it for about 20 years now, and I've been working with GLP-1 patients very specifically. I've become sort of an expert on that and personalizing the dose, microdosing, and all that in the last 5 years. So I also design weight loss protocols for telemedicine practices that are looking to use those medications, especially the compounded forms, in better ways so that patients are not experiencing side effects and they're getting all the good of those medications without all of the other unnecessary issues that can go with it if they're not properly dosed and managed.
And I love that. And how you mentioned that you were able to reverse your Alzheimer's before the call. You had mentioned that you're
Yeah.
also on these regenerative peptides like GHKCu and BPC. So, for those that are new to the topic, what
Yeah.
exactly are these regenerative peptides and how do they work in the body?
Yeah, so it's not like like a pharmaceutical medication that's tamping down some symptoms. So, and I love that from a functional medicine background, our goal is to identify and treat the root cause and work with the body, like bioidentical hormone replacement for the thyroid, the same molecule our bodies make, even GLP-1s. Our bodies make GLP-1. I consider it bioidentical hormone replacement for the metabolism. So and peptides work in the same way. We have peptides in the body. They're just regenerative peptides. They're just small chains of amino acids that act as powerful messengers in the body. They signal to your cells to repair and rejuvenate and reduce inflammation, which is just huge. They're like the body's repair crew to heal injuries, rejuvenate skin, restore healthy function. And I didn't even know any of this when I first started using BPC was the first one I started using. I had just read about it for cognition improvements and for Alzheimer's. And that seems to be the thing that people learn about it last these days, but that's what got me into using it. And then as I got toward, I'm 52 now, getting into perimenopause and menopause, where everything starts breaking down and the frozen shoulder and the knees and the hips and everything hurts, it has been incredibly helpful for injury repair and just the chronic pain and inflammation that comes with menopause, even though I'm taking all my hormones. So it's just, I don't know what I would do without them. So it's going to, any sort of stress or injury. And as we age, these natural peptides fall in our bodies. And so we're giving them back. And I love that.
Nice. And later on we'll go into your own experience because you shared some really amazing insights on these peptides. But
Mhm.
what have you seen that makes GHKCu and BPC TB 500 stand out among other regenerative peptides? So let's focus in on these specific two.
Specific. They're some of the longest studied peptides that we have. So there's a lot of peptides out there, but there's either not a lot of studies, they haven't been around as long. These have been around for a long time. They've been used in sports medicine a long time. They've got great safety data behind them, which I love. Um, but as we age, these peptide levels drop, and we just take longer to heal. If you see your grandparents or your parents get injured, you notice that they're like, wow, they still have that cut or that bruise like way longer than they would normally. Um, and so it just gives you that faster healing like you had in your youth. Um, and I mean, it's used in sports medicine all the time. And I just love that it's not surgery and it's not steroids, it's not painkillers. We're just covering up symptoms, treating the root cause. Um, so they and then work if you take all three at once, they work synergistically together. And that's how I've been doing them. And it has boosted healing of my shoulders by quite a bit.
Have you seen any results with and without peptide therapy in your experience?
Yeah, so this is pretty well, yes, in my own experience, I'll tell you this. So last summer I was in Costa Rica and I was away from my personal trainer and working out in a gym by myself, and I lifted too heavy and I hurt this shoulder. And I didn't do anything at first. And for the first 6 months, it just didn't get better. And then I started just BPC 157 and it got, 30% better. And then I started reading about, oh, I need to add TB 500 and then GHKCu. And now it is like 90% better, which is just amazing to see. But I will say, okay, let's see, where is the study? Even BPC alone reduces recovery time by as much as 80%, you guys, especially with tendon and soft tissue repair. So that's 5 times faster. And then it's even faster if you add the TB 500 and GHKCu. So you may have heard all three peptides together as the glow stack. Somebody asked me about that the other day, and I was like, I don't know what that is. And then I realized, oh, I do know what those peptides are. I just don't know. I just had never heard it called that. So faster recovery for skin, muscles, tendons, ligaments. Um, so I think it was really great for me. Like I've been very open on these educational series that I've had a facelift after my divorce in 2023. And I'm certain that these peptides helped me to repair and recover faster from that procedure. I was back on Zooms and no one noticed in 9 days. I had no bruising. I have no scars. I mean, you got no scars, like no,
Wow.
really no scar. And that's one of the things that's, it does reduce
Hmm.
scarring because these peptides reduce the inflammation that causes the scarring, like the inflammatory cytokines. Um, and boosts collagen production. And so I feel like it's really helping me keep the results. I mean, facelifts are not cheap, and so I'm trying to really care for it. Um,
Hmm.
and I've just been really happy with it. I've also dealt with massive hair loss in my journey. Um, and it's been helping with that a lot, a lot. Let's see.
Yeah, I see Magda has said also for GHK that her skin is getting tighter, her nails and hair are growing, and with BPC, it's also helped with her frozen shoulder.
Isn't that because it's terrible? You can't like reach back anymore. Let's see. Actually, this is so funny. Okay, I just did my shot because I just did it today. This is crazy, you guys. Look at this. Like I couldn't do this yesterday. I was just doing this in bed with my fiance. That's insane. Wait, let me see if I can do this. I could touch my hands. Okay, y'all stop. I could always touch my hands like this in my youth. I couldn't do it yesterday. I did my shot. Okay, okay, sorry. This has been so frustrating and so incredibly painful. I've been working out. I haven't stopped working out. So I've just been working out through pain. And I hate to do that, but I also don't want to lose muscle mass or
Hmm.
bone density that I have grown. I was almost
Hmm.
osteopenic after just not working out through my divorce. You know how it is. It gets really
Hmm.
stressful and you're like, you don't have the bandwidth to go to the gym. So I was coming back from that. And
Hmm.
I can't wait. Y'all, I'm sorry.
Yeah,
That's a
we're getting
big
more
deal.
people who are saying the same thing that it's helped with their frozen shoulder. So that's amazing. And
I
going,
love hearing that.
yeah, going a little bit back, how you mentioned GLP-1s, do you think that these are good to pair together,
Oh my God.
especially with the hair loss and the skin?
Oh, huge, huge. So GLP-1s are one of the biggest anti-inflammatory agents that we have. Like you can look up the study. It's called glucagon-like peptide 1, a multifaceted anti-inflammatory agent, and go down to figure 4. It has all of the things it does in the body that reduce inflammation. It's actually incredible. Like even if it didn't cause any weight loss, these peptides are just amazing for that. Dr. Tina Moore, Tyna, has a series called Ozempic Done Right, and she microdoses GLP-1s for inflammation and chronic pain specifically. She does not need to lose weight. She does it because she puffs up and gets inflamed, and the chronic pain is so bad without it. And I see a lot of my coaching clients doing the exact same thing, which is awesome. And I would think it would be an amazing stack. I'm not on a GLP-1, but my fiance is just for maintenance and just for heart health and general longevity. It's the best longevity tool we have. Like I would want every single family member of mine on a GLP-1 and on GHKCu, BPC157, and
Hmm.
TB500. And I try
Hmm.
to get all of my coaching clients on it. I just feel like there's not anyone who
Hmm.
wouldn't benefit from it.
And we have a question that came in that asks if you're doing BPC 157 capsules or injections, but going a little bit into that, do you feel that it's still the same results?
Yeah, I think it has. I mean, so I was in so much pain. I literally got on Ellie and I ordered both the injections and the capsules and have been doing both. And I just ran out of the capsules. But you guys, unlike a lot of peptides like GLP-1, the injections of GLP-1 are way more effective than the oral GLP. For most patients, some people don't need that full dose and the oral is perfect for them or the needle phobia. So it's great to have both. But in the case of BPC157, the oral is just as effective, and it's especially effective for gut health. And so, when I first started working with patients on GLP-1, we had this compounding pharmacy that actually compounded their GLP-1 with BPC157 for GI side effects. Yeah. And it was so popular, you guys. It was from Wells Pharmacy. I don't think they offer it anymore because I think it's tougher to get BPC injectable. But boy, they loved that. And those patients were happy, happy clams.
Hmm.
And I will tell you, incidentally, I have been really strict no gluten for at least 10 years because of what it does to the gut brain barrier and promoting inflammation in the brain and laying down of Alzheimer's, the amyloid plaques. Um, but I ordered groceries a couple weeks ago when my daughter was here, and they accidentally sent cookies and cream ice cream instead of plain vanilla. And that sat in my fridge. You guys, as a former type 2 diabetic sugar addict, it just sat there. And then I ended up eating half of it. I haven't had gluten in years. And I swear to you, that's why my body puffed up. I haven't never had pain that much, that
Hmm.
extreme. And I will never, never, never do it again. But I'm so glad I had my peptides. I had to do them like daily, and I don't even know if you're supposed to do that, but I've just done it because I was just like, I can't move and I can't get out of
Hmm.
bed. I feel like I'm 80 years old. And
Hmm.
but it was, I mean, a good experiment in a way that I'm like, no, yeah, I'm not just doing a fad of gluten free. It makes a
Yeah.
difference to me. Um, so let's see, what were there was one other question.
Yeah. Someone asked for your shoulder if you have any recommendations for specific locations or in your experience, is there a specific area that you've done?
You mean to inject?
Hmm.
So BPC, these peptides, they go systemically throughout the body. So I typically inject them in the abdomen because that's where most subcutaneous injections go. You can inject them, on the fatty tissue of the upper outer thigh, the fatty tissue of the back of the arm, the saddlebag area, and the back of your booty. I have tried to inject them into my shoulders directly. I haven't really noticed that much of a difference, but I think I might just start doing that. I've heard different things that it matters, that it doesn't matter. But it's harder to get. These are subcutaneous injections, so they are technically supposed to go in this subcutaneous fat. So it's a little bit harder if I'm like, where it hurts, I'm like, that's basically muscle. So I just don't know if that would improve the effectiveness or not. But I can find a little subcutaneous fat back here near it, but it's harder to inject
Hmm.
your own because you have to pinch that fat to get it. And I'm like, how do I pinch it and do it? So I'd have to get help.
Yeah.
Uh, but I probably could get my fiance to help with it. But yeah, you can really do it anywhere you want. And if you're
Hmm.
already doing, and I mean, I tend to put all my peptides in one syringe, and just do them all at once in one place, so I don't look like a total pincushion. But you can do it however you want.
Nice. And I believe in the past you talked a little bit about hypothyroid and Hashimoto's.
Yeah.
Is there any peptides that you suggest for those?
Yeah. So I actually, one of the medical practices that I contract with to run their GLP weight loss program is a thyroid practice, and they are using GLP-1s specifically to reduce Hashimoto's and Graves' antibodies, and it is working so well. I mean, they've already been using, thyroid medications, obviously, but things like low dose naltrexone to try to reduce autoimmune antibodies, gluten-free, dairy-free, all the things that they know. But some patients are just super inflamed and they can't get those antibodies down. Their thyroids are slowly being destroyed. And the GLP-1 add-on is just incredibly helpful because of the
Hmm.
anti-inflammatory effects it has on the body. And it's helping those patients stay away from gluten and cow's dairy, which are the biggest culprits in raising the Hashimoto's antibodies.
Nice. And
Mhm.
going back a little bit to healing before we go into aging and longevity, because I'm seeing some comments about longevity. How
Yeah.
soon do you see people are noticing results with BPC and GHKU? And I know you mentioned that you had your procedure done and the GHK has really helped with the collagen production on that.
I feel like it really has. I mean, I've seen a lot of other facelift recovery, just because I'm at the age where people are getting them. And it just seems like people are, I literally have no bruising. Like I just can't even, and then the no scarring, I've just seen a lot more scarring. Like nobody's even, unless I tell people, they don't know that I've had the procedure done. Um, and so I would say for the most part, and this was the case for me, most people are going to start noticing benefits of these peptides within 1 to 2 weeks for like acute injuries and after procedures. But for more chronic issues, it might take 4 to 8 weeks to see full benefits. But you're probably going to see less pain, faster healing, better mobility in a shorter time than expected, just overall.
Hmm. Nice. And as we're shifting over into aging, so we know that the body's ability to heal and recover naturally slows down, whether it's from joint pain, surgery, or just everyday wear and tear. Is there
Yeah.
any specific types of injuries or chronic conditions that you found peptides like BPC and GHKCu to be particularly helpful with, especially if those are used over time?
Yeah, I mean, I think they've been shown to reduce wrinkles. What was it down here? It was crazy. It was like reducing wrinkles by something like reduces wrinkles by 55% over 8 weeks and 32% decrease in wrinkle depth. What? Like that's
Wow.
actually insane. And the
Mm-hmm.
systemic subcutaneous injections increase skin strength by 30%, reduce wrinkle depth by 25%. That's another study that was over 12 weeks. It's like this is the other cool thing. We just are super inflamed in my family. So eczema, just rashy kind of people. So it's got an anti-inflammatory effect, all three of those peptides. So my daughter has eczema. She loves BPC157. BPC157 also helps with hangovers. So I have a little bit of a suspicion that she's coming to me for that instead of her eczema. Well, it's always on Sunday morning. She wants her BPC 157 shot. But it really does though. Um, so I'm like, okay, fine. It does. It helps with it's ethanol poisoning, essentially, is the
Hmm.
thing repair that. Pretty
Wow.
crazy. I know, who knew? But like sun damage, damage to joints. I have coaching clients. Two of them right now are on BPC TB. Um, and one is recovering from an Achilles injury that was really severe. And I saw him, and he's only a month or so out of his surgery, and he's walking like normal and working out again. And I'm just like, you gotta be kidding. And the other guy had terrible knee injury with skiing, and he's also back to working out, just
Hmm.
which at our
Wow.
age, that can not necessarily happen. Repairing the gut lining. So if you're having any issues with if you have Crohn's disease or you have colitis, anything sort of gut related, you're already gluten free, but you're getting gluten when you go out to eat sometimes, and you just want that extra protection, be really helpful. And then of course there is the cognitive and mood benefits
Hmm.
that are just really, really helpful too. Injuries, burns, cosmetic procedures, scarring reduction. So it reduces inflammation, but it helps improve or increase angiogenesis. So there's more blood flow to the wound site, which
Hmm.
is huge, and that helps infuse the area with oxygen, growth factors, and more nutrients. Increases collagen production. So just firmness, elasticity, that kind of crepiness of the skin that you start to notice, right? That's like,
Hmm.
what is happening? And things are just sagging. And like, some people notice it in shorts that they're just like, uh-oh, my knees are starting to look like my mom's knees or, that. And so helps with that. Um, Redness, rashes, we talked about. Um, yeah.
It, what?
Oh,
There's an
acne.
interesting question if any of these peptides help with rosacea. Would
I was about to say
GHK?
rosacea, yes, is on there. Rosacea, psoriasis, post-acne scarring, sensitivity, yeah,
Mm-hmm.
and eczema. It reduces pro-inflammatory cytokines. So all of that.
So
Yeah.
many benefits. I
I
still
know.
need to add it to my
Oh, and you
peptide
guys, I'll show
list.
you this if you're curious. So these are dosed 3 times a week for 8-week cycles. Peptides are cycles. You can go on and off. So if you're like, this is expensive, you can go on and off and it's fine. This is cool. Look at GHKCu. It's blue. It's like a Smurf. It's so fun. I know. And y'all, I'm gonna go ahead, Brenda. Can I tell them, y'all, or maybe y'all, I'm just dumb. I literally couldn't get this out of this container. Or did y'all have this problem? I can't get, I know. This is why I'm an idiot. Okay, so I am an idiot. Okay. And same with all of my older coaching clients, because I coach all these women who are like my age, 50s, and we wear readers. We couldn't read that it says squeeze. We totally missed that. And we all have like arthritis. So we're trying to open it and we can't. And we're like, I guess we're just old. And Brenda's like, just squeeze. And so I put it back in and I went like this. Okay. So anyway, but if you're out there and you're just the one person who was like me, I helped one person. I'll be
Yeah.
glad.
If anybody else was struggling and you came to this call, just take this one
I
piece
mean,
of
I was like
information
with
and squeeze.
cold and like biting and like, oh, it was so embarrassing. Oh my gosh. Oh.
Oh man.
So anyway, yes, you can put all this in there and it's 20 units 3 times a week. So you could put it in with your BPC. My BPC, I
Hmm.
think it's like 10 or 20 units. I can't remember how much it is. I think it's about
And
that.
going
Or
back into cycling a little, since these are both a little bit more on the regenerative side, do you think that it's better to combine these how maybe into the glow stack, or would you see maybe someone do GHK, cycle off it, go into BPC, maybe if they're trying to heal something for longer term?
so all the research I'm seeing is that doing all three of them together is really the way to go. That all three of them together is really the synergistic combo. And that's what I'm doing. And I don't know, I'm just desperate because I'm in pain also. So I'm like, yes, we're doing all of them. And we're gonna see how that goes. But yeah, I mean, you could technically try. I mean, I'm all for self-experimentation and an N equals one. Everybody's an individual, and you may respond really well to cycling BPC and TB 500 and then trying cycling the GHKCU. It can also be
Hmm.
a budget issue, right? So who cares? Do what you can do. And that's perfectly fine. But for me, I'm trying them all at once because what I'm reading is that they do synergistically work all together. I'll get more out of each individual one by doing them all together. And that's kind of more bang for your buck. So it's cheaper.
Hmm.
That's what I'm telling myself.
Nice.
Yes.
And do you see results varying between younger and older patients? Is there a group that are seeing results faster?
Yeah, so this is one where older people actually do better. So, because our peptides are falling as we age, we're going to react more because we need them more. We're like a dry sponge, and you give us peptides, and we're like, and our tissues plump up back to where they were. Now, young people already have their peptides, so they may not really see incredible results unless they are, healing from a sports injury, that kind of thing. That's where it's really used a lot of times in young people in sports medicine. But yeah, that's one where
That's interesting.
older people have more
Hmm.
dramatic results.
Wow, nice.
And did you
And
guys know that semaglutide and GLP-1s work better for women than men?
oh, that's interesting.
Men lose more weight on them than men. Well, we have one
Hmm.
thing, y'all. We have one thing. I got the one thing. And then if you're old and
Hmm.
a woman, we have the peptides and the GLP-1.
One of the questions that came in asked if NAD can fit into all of this.
Totally. Oh, absolutely. Yeah. I haven't added that one, but I need to. I 100%.
Hmm.
Yeah, there's too much good data on it. It's just I have an entire supplement closet and like peptide refrigerator, and sometimes I just get to the point where I'm like, I can't wear a bathing suit because I have so many bruises on my stomach from trying to turn back time. Like at a certain point, I'm just gonna be like, I'm just old. It's fine.
Yeah.
But
No,
it
I
is
mean,
so much, and I want to
it
live.
does.
I got through this divorce. I'm like, I'm newly engaged and I have this life to live and I have this business I'm running
Hmm.
and it's like doing great. And I'm like, I want to start over and I want to live my second half of life and not be done, right?
Yeah.
I feel like it's letting me do that and have that second chance.
Oh, for sure. Like
Yeah.
I went ice climbing a few months ago and I was at this peak cold. It was borderline fever, and I'm doing this trek up this mountain to
Wow.
also climb for the next couple of hours. And I was just so sick that I didn't want to take nightfall because I didn't want to wake up the following day and be all queasy. So I had brought my glutathione and my NAD, and I
Oh,
swear that was able to push me through the day and do these like 5 mile hikes and climb for these hours. And then I would go back to the hotel, take the injections, and then just sleep and still wake up with energy the next day.
that is amazing. I've heard that about NAD plus. One of the owners of this medical practice I work with, she uses it like if she hasn't slept or she's traveling or just really tired, and it really boosts her and gives her energy for the day. And I'm like, I need that because there are some of those days where you're just like, especially with the hormones that I'm dealing with, sometimes I just don't sleep. I'm just like, I'm trying to sleep and I just don't sleep, and then I have to function the
Hmm.
next day. I think that would really be helpful. So
Hmm.
I'm all for working on that.
Yeah. One interesting question came in that says, if you could only afford one, which is the best product for chronic pain? And I think there's a lot of peptides that can help with it. So what would
There
you suggest
are.
is
It depends.
there
So
seen?
if you have weight to lose, I would start with GLP-1, honestly, because that's going to hit so many anti-inflammatory pathways. And I've just seen it work on chronic pain. So if you have weight to lose also, you're going to get kind of both together. And it's a great way to start because when you get to a healthy weight, we have a lot of chronic pain is resolved anyway. But I'd say what I started with was just plain BPC 157. It's been around forever and ever. And you might just, if you could only afford one, start with there. But I think the one that we offer at Ellie is combined already with TB 500. So maybe you just start with that. That's kind of what I did, and then I added the GHKCu after. Um, and I kind of have liked doing that because I can see like what's causing what. Um, and so I just went from BPC 157 alone to BPC with the TB 500 with the oral BPC as well, and then adding the GHKCU. And so it's just been better and better and better the more I've
Hmm.
added all three of them, in addition to my hormones, which are critical,
Hmm.
and not eating cookies and cream ice cream.
Hmm. And it's Charity said that GLP-1 makes her feel as if she has a lot of fatigue.
Hmm.
Going into the energy and resilience with these peptides, and we know that healing is one part, but what about performance? Have you seen that these peptides help boost energy and resilience?
I love them. I tend to do them in the morning on my workout days because I feel like they just give me better energy and performance in the gym and then faster recovery after. So I love them for that. And I just think they make me mentally more sharp. There's just they kind of work all together. When you're having brain fog or even depression and anxiety, a lot of times they found that is neuroinflammation, so inflammation in the brain. So to the extent that we can reduce that inflammation with peptides, I think that does help us feel a little more clear and happier overall, which I'll take any day. But yeah, I like those on the mornings of my workouts
Mhm.
or even the
Yeah.
night before.
Mhm. Yeah, Amanda has a comment that says that she has a strong history of Alzheimer's in her family, and she's very interested in these for prevention and cognitive health. What are your thoughts on that?
I think that's a fantastic idea. That's literally how I got into the peptides that's what I read about them helping with in the very beginning. And yeah, I'll do anything to hang on to my brain. I'm 52, my dad was very sick by my age already. And so I'm like, hanging on. We'll see. And I'm sorry about your family. It's really stressful. It's kind of, I mean, I would never wish cancer on myself or anyone, but I'd almost rather have that because you at least have your mind and you can at least,
Mhm.
I don't know. I don't know. I just don't want to
Yeah.
be that kind of burden.
Hmm. And on stress, have you seen that BPC 157 TB 500 can help with fatigue or burnout caused by physical stress or maybe overtraining?
That's really interesting. I think the studies show yes, that's true. I mean, it helps with recovery, helps you recover faster. But yeah, like I feel like I do so many things. It's hard to tell what's doing what, but I would say my ability to manage stress and just take on more and just not be so bothered about it has
Hmm.
definitely improved. And I don't know if that's just me getting older and wiser or if it's all the things that I'm doing, but I definitely feel better and just sort of like, yeah, I can add that. I can totally do that. I don't need to say no
Hmm.
to everything or isolate myself. I'm like, we can figure that out. It's like
Have you
it's a resilience maybe.
mhm.
Yeah.
Have you seen in any of your patients or have read up on any studies that for these regenerative peptides, if they're supporting in mental health or emotional resilience? There was a comment in here that talked about um, their emotional health, and I can't find it anymore.
Yeah, I have read that. And I think that's due to reducing inflammation.
Hmm.
Um, because if your brain is inflamed, you're just gonna have worse mental health, that's for sure. Uh,
Hmm.
but no, I don't I'd have to look up if there was a specific study.
Hmm.
I'm sure there are. There's a lot of studies about BPC 157. It's been around a long, long time. Let's see. Uh-huh. Best GLP-1 to use for longevity, the one you can get a hold of. They're both
Yeah.
amazing. Yeah, whatever you can get a hold of. Um, yes. Microdose is great for maintenance. Yes. GLP microdose. Absolutely. There's no reason to stop taking it. We have 20 years of safety data on GLP-1s and they're approved for long-term lifetime use. And especially if you're maintaining on a low maintenance dose, you can inject a small amount every 1 to 4 weeks as needed. No big deal. No reason to just stop it. Let's see. Knee
Yeah, we have a
replacement.
lot of questions. So if there's any that stand out to you, feel free to answer it.
Okay, for one. Don't have health, Hashimoto's, but I'm keeping maybe tired. If it made you tired, the GLP-1 made you tired, try improving your hydration with some electrolytes. That helps a lot. Na na na. Okay. Do you have to cycle BPC 157 and TB 500? That's a really great question. And I've actually wondered that myself. I haven't been cycling it because I've just been like, do I still hurt? I'm still doing it. So I've been doing it about 3 times a week each week. Um, but I think from what I have read, it's fine to do it for a while, like without cycling it while you're basically repairing. And then once you feel like you're healed, then you could try going off. And that's kind of what I'm planning to do. Uh,
Hmm.
will BPC-TB 500 capsules help with the tendonitis as well as the injection? I think they both help. I think the injection might be slightly better for tissue repair, but they both really do have been shown to work. Um, Rheumatoid arthritis, I'm sure that it would help. That's an inflammatory condition. It's an autoimmune condition. So, no gluten, no cow's dairy, avoid any, biggest things that cause inflammation, gluten, cow's dairy, alcohol, and sugar and processed foods. So get rid of those inputs and then do anti-inflammatory supplements like pro-resolving mediators, microdose of GLP-1, and then this stack of peptides that's super anti-inflammatory that can help a ton. NAD plus, BPC, TB500. Has anyone taken the GHKCu for hair loss and noticed that you're doing better? I'm noticing way less hair shedding in the shower since I started it. Yeah, yeah, same. You good, Chrissy? I love that because it's so depressing to get in the shower. Yeah, and more length. Oh, thank goodness. Yeah, I could just looked at my shower this morning. Lots of new growth. Yes. Tips to stay hydrated, not thirsty. I know you have to force yourself to drink water if you're on a GLP-1. I like Dr. Berg's electrolyte powder. I don't sell it. It's on Amazon. It's really good. It doesn't have maltodextrin or sucralose in it, which most of the other ones do, including EllieMD, which raise insulin higher than table sugar and cause weight gain. So you want a good electrolyte that's sugar-free, does not have sucralose or maltodextrin, and just force yourself.
Hmm.
Just force yourself. That's the biggest cause of fatigue and headaches on a GLP-1. Yes. Oh, get your hair extensions out. I know I was so close to getting a wig. and hair extensions. I was being fit for a wig 5 years ago, you guys, because I lost half my hair. Because I was just so sick from being on the birth control pill, and I just was so bad.
Wow. And
Yes,
that's with GHKCu?
this is with yes, with the GHKCu is
Mm-hmm.
really helping my hair. Like
Mm-hmm.
I just have noticed, like, because I have this little like drain catcher in my shower to track
Mm-hmm.
my hair loss, just to, so I can see, like, okay, how bad is it this week? How good is it? And I've noticed since I started the added the GHKCu, it's been like really minimal, like
Mm-hmm.
way less. Like it was already less with thyroid and hormones and the BPC and all the other
Mm-hmm.
stuff, but even the GHKCu, I'm like, oh, this is the next level of
Wow.
hanging on to my precious strands of hair. Um,
Yeah, and that's just on the outside, so we don't even see the repair that it does on the inside. Do you have any
mhm.
insights of how GHK supports cellular repair?
So it's specifically, let me see. It is really in its biggest way that it does is boosting collagen, apparently.
Mm-hmm.
So skin remodeling, collagen, and elastin synthesis. So increasing firmness, hydration, and elasticity. And it
Mm-hmm.
works, you guys. This is one of the, I didn't know this. I'm really lazy with skincare and in buying expensive skincare products, but the research I'm doing on, yes, that's right, Diana, Dr. Berg's electrolyte powder. Um, on GHKCU is that the topical is extremely effective. And I think that Ellie has a lot of the topical under skincare. So it's actually worth it. So I'm actually going to try it. I've just been burned so many times by buying so many skincare things that just didn't work.
Mm-hmm.
There's research behind this. So both the injectable and the topical. So I love that. And that's because of the small molecular weight. Apparently, it's actually able to penetrate the skin and do what it's
Oh,
supposed to.
nice. Mm-hmm.
So it's up-regulating two types of collagen, types 1 and 3, which are the keys to youthful, firm skin.
Mm-hmm.
It boosts elastin, which gives that your skin's ability to stretch. And when you lose elastin, you get sagging and laxity. Antioxidant effects. Oxidative stress, as we all know, causes accelerated aging and pro-inflammatory cytokines, which lead to that skin redness. That's where we get like the sensitivity and acne, rosacea, eczema, psoriasis, and post-acne scarring,
Mm-hmm.
post-injury scarring. And then it enhances wound healing by modulating the immune response, by just kind of
Mm-hmm.
calming that down. I think that's one of the reasons I didn't scar. Like I can't even believe it. Like I can't even tell I got my eyes done, you guys. Like I got upper and lower bluff. Like you can't, I don't see I just can't. I don't even know. I quit telling people honestly that I got a fake. Y'all are like the only ones who know now because I just figured everyone was going to know and just tell me. So I was telling everybody before they noticed. Um,
Mm-hmm.
but people just weren't saying anything, so I quit. Um, yeah. And so BPC is derived from gastric juices as opposed to the GHKCU. And is from the gut line, it helps with the gut lining, and that's really with wound healing. And then TB500 speeds up the wound healing and tissue repair by, especially in joints and muscles, and helps the damaged cells repair more rapidly. So they all
Mm-hmm.
do kind of similar things, and then you put them all together, and then they each one works individually even better.
Mm-hmm. And there was a question that had come in on times for injections. Have you noticed a difference between maybe injecting in the morning compared to at night?
I haven't. There's one peptide that I do not inject at night anymore, which they tell you to inject at night. It's called CJC ipamorelin. Um, and it's a growth hormone releasing peptide that you're supposed to release at night or inject at night because apparently that's when your body is supposed to release the most growth hormone. If I take that injection at night, I can't sleep like at all, at all. So
Mm-hmm.
I take it in the morning along with my BPC and all my other peptides. I tend to take in the morning
Mm-hmm.
before I work out on an empty stomach. It helps to take the growth hormone one on an empty stomach too.
Mm-hmm.
Uh, so yeah, you can really, but BPC, TB500, GHKCU, I've never noticed that any of those three keep me up. So
Mm-hmm.
that's all I care about is my sleep. And so I've injected those at all different times. Like sometimes I'll be like, oh, I have a workout in the morning. I'm going to go ahead and inject those tonight. I've been perfectly fine.
Mm.
Anybody else had an experience injecting them and had felt like one time of day was more effective?
Have you tried Summerellin? 'Cause that's
No,
also mimics the growth hormones, and
I haven't
I'm just
yet.
so bad at doing it at night because of the schedule that it is.
I know
But
that's what G it's CJC ipamorelin. It's similar. It's similar. Um, but yeah, I haven't tried the Sermorelin yet, but similar. If I was going to try it, I would probably try it in the morning, even though you're not supposed to. You're supposed to take it
mm,
at night.
hmm
But I have such terrible insomnia that I cannot mess with anything that messes.
hmm
I can't even take B vitamins after 12 noon, or I'll be like, oh, I can't sleep. Microdosing creatine, you should macro dose creatine, 5 grams a day, ladies. It's awesome. Take it. I do, especially 5 grams. I use clean creatine, Kleen. I have no associated with it. My son introduced me to it. It's a really fine powder creatine that you can buy on Amazon. And so it just dissolves it really well in water along with my electrolyte powder. You can open up creatine monohydrate capsules and put it in your water, but it's real gritty and it just doesn't taste good. I like it. The clean creatine looks like powdered sugar. I love it. Yes, up to 20 grams of creatine a day for neurological benefits. Tiffany, you're 100% right that they're showing that like even higher doses can be even better for brain health. So yes, for buffer muscle maintenance and muscle mass, at least 5 grams a day. I can tell you, I probably don't get that. I know I get 5 grams a day on my workout days, 2 to 3 times a week, and then I get at least 1 gram a day in my or 2 grams a day in my supplements. But um, sometimes I get supplement fatigue, and it's just a lot to take. So,
hmm
um, but yeah, I'm actively trying to take more. Creapure or creatine, HCl are the best. Yeah, creatine monohydrate is what you're looking for. Let's see, add it to protein shakes. That's a good idea. I like
That's a good
that.
idea, yeah.
And that's not a bad idea. Um, I do GHKCu at night now to avoid the sting. Let's see. I feel like I noticed results with the GHKCu within a couple of weeks. I started to notice the less hair loss and the just like smoother skin tone, just kind of less puffy, and then just additional movement, a range of that's what I'm
hmm
looking at is range of motion. Like every night before I go to bed, I'm sort of measuring like, can I reach back and grab my water? Like
hmm
I haven't been able to do that. In my car, like I would not be able to reach back and hit my kids and tell them I would be totally prohibited from doing that.
And you
But
notice those results with BPC?
I've noticed BPC, I noticed like a 30% improvement. When I added TB 500, I had probably noticed another 30 to 60% improvement with the two of those. And now I think I'm with the GHKCU, it's more like getting toward 90% improvement, which is
hmm
so
Wow.
so hopeful because
hmm
I've just never dealt with chronic pain. I've been really lucky my whole life. Like I've had great movement. I've never had knee issues. I've never had joint pain. This is all since I turned 52, which is the average age of menopause, or maybe it's 51. I can't remember. So,
hmm
but this is when it all starts going, and we have to start taking care of it. So I'm really glad to have these options and to give
hmm
them to my coaching clients who are looking for, non-band-aid solutions.
And going back to perimenopause and menopause, have you seen any improvements with patients who maybe are at that stage and are looking to experiment with any of these peptides?
This is huge. For some reason, it's my most of my coaching clients who are on these are men because they've messed up their Achilles or they just tend to do more stupid stuff and get injured. But my women, I'm really trying to introduce the women to it because there's something called musculoskeletal syndrome of menopause. It is super common, and what it happens to women my age is we end up going to the doctor and everything hurts, and we're diagnosed with fibromyalgia or crazy lady disease, or we're a Karen and we're making it up, or right. Um, or we get sent to, or my mom, right? Boomers were taking off all their hormones. So she's a hot mess, has had, I don't know how many shoulder surgeries, but no hormones. No, of course not. No peptides, nothing. None of the surgeries have worked. She's had so many cortisone shots that have done nothing but degrade the inner collagen and of her of the joint. And that's known. It's a Band-Aid fix to
Mhm.
lower inflammation, and then you get actually worse. She can barely move. Her fingers are like this. And so, what I want to do is really get the word out for this patient population that yes, first of all, don't be afraid of your hormones. Get your hormones replaced. Bioidenticals are super, super safe. All of that has been debunked. And they're critical for obviously hormones for your heart health, your brain health, dementia prevention, and your joints and muscles and prevention of UTIs and all of that.
Mhm.
But get on the peptides too, because our peptides as we age are also falling. And there's no reason not to do all of it. And like I said, I'm already doing all three peptides, testosterone, progesterone, and estradiol, and I'm doing high doses for because for me that's where I feel my best. And I'm still having the pain. So and I'm doing all the things with what I'm eating and all that stuff. Um, but sometimes, but these guys, this is helpful. This is really helpful. And I'm sorry, I'm sick of having thin hair. So if this can grow my hair back too, I'm going to be super excited. I wonder,
Wow.
my question, this is my dumb question that I'm going to research somewhere. I wonder if you can inject GHKCu directly into your scalp. I wouldn't do this myself. That seems like that is not a subcutaneous injection, but I used to work in a aesthetics practice where they were injecting like exosomes and PRP into the scalp for hair loss. And I was like, I
Hmm.
wonder, but maybe there's like a topical GHKCU for hair loss. There probably is that you could like micro needle into it. Maybe, I don't know.
Hmm.
I don't know. I have questions. Rub the new Ellie skincare up there. That's what I'm thinking. Literally, I'm just gonna sit there and just like put it in there. Um, what did I call it? Musculoskeletal syndrome of menopause. Musculoskeletal.
And I know we're wrapping up here. Is there any final remarks you'd like to leave us with? I know that there's a lot of information that we just gave out. So for anyone that's looking to go back and get any information, just check the YouTube tomorrow. So the
Yeah.
replay will be up. And I know there's so much more we need to cover from the hormones, the root causes, and how we can better integrate these peptides for that. So Sally, we're definitely gonna have you back.
Thank you. And this was so fun. And I just hope for you or for any of your, clients, for you tell them not to give up because I literally was getting so discouraged by the chronic pain because I was like, I'm doing all the things. Like I am not some lazy bum who's not working out and I'm eating like crap. Like I am doing all the things and I'm still in so much pain. To have this as an option, I have never had chronic pain in my life. You hear about it just ruining lives, and it does. Like you're literally thinking about it all day. You're like your whole body hurts and getting out of bed and feeling like you're so old and and I inside I feel like I have this whole life to live. So if it's you that's feeling that way, don't give up. If it's your family members, don't give up. Your people who are buying from you, you're helping them get access to these peptides, really encourage them. That's one of the great things about being a representative of LEMD is like it's not even selling. You're literally just helping people. I don't know how to sell to people. I don't. I am terrible. Like my business is terrible at selling. I cannot tell you about something or explain something to you or recommend something unless I've either done it myself or I know it works. I don't know.
Mhm.
I would be terrible if it's the whole sales thing, but that's what Ellie provides things that are like life changing and you can provide access to these things and so
Mhm.
you're changing the world, you really are, by educating your friends and your family members on this. So ooh, birthday sale. Oh good. I'm so glad you guys are so
Love it.
sweet. Yes. And who said that? Dana, thank you. Vonda Wright for more on the musculoskeletal syndrome of menopause. She actually wrote a paper and published it recently. Vonda Wright, and it's called the musculoskeletal syndrome of menopause. And yeah, it's lack of estrogen. I actually did extra estrogen this week, and I think it helped too. So you know, I'm just gonna keep. It's like whack-a-mole. Uh, but I'm always happy to get on here and let you know about all the new
Yeah.
things I'm learning. And thank you so much for everybody for your questions and your enthusiasm. And I just appreciate you so much.
Yeah, there was so many questions for you. So how can we get into
Oh yeah.
contact with you?
Yes. Okay. So you can reach me. Let me put my link tree in there. Because that's the fastest way to just get all of my socials and Instagram, YouTube, podcast, and how to, if you want to ever book with me to like look at your labs or you have someone you know needs an in-depth lab analysis. Sally Sykes. There's my link tree.
Love it.
And that just sends you to everything.
Hmm.
So lots of free content there, but you'll just kind of see what I do, how I work. You can just start learning on your own everything that I do. And then if you're like, oh yeah, I would like to work with you, you just give me a call. The first 15 minutes of every appointment is free. So we can often, if we're not a good fit, I can often point you in the right direction. That's perfectly fine. And I love just meeting you guys, the people who come to these
Wow.
educational series. It's so fun when y'all book with me, and
Hmm.
I just love it. So
Love it.
let me know,
Yes. Thank you so much, Sally.
you guys. Have a great night.